and welcome to our show. This is Your Health Matters on Sun 20 TV. I'm Shari Einhorn. We have a great show for you today. My first guest is going to talk about bariatric surgery and weight loss. She is Dr. Kinga Powers from the Bariatric Surgery Center at Stony Brook, Southampton Hospital. Thanks so much for joining us. This is a really important topic, but I think maybe people are a little bit confused. So why don't we start with some basics? What is bariatric surgery and when might it be appropriate for a patient who's been struggling with weight loss?
Well, bariatric surgery is one of the ways that our patients can lose weight. So if someone is 100 pounds or more overweight and has been struggling with weight a long time, and they have tried diet and exercise and different things, and things are just not working, we consider bariatric surgery, which is weight loss surgery for them.
And so it's not appropriate, I would assume, for every patient in that position. There's more that goes into the decision making, yes?
Of course. So I see patients in my office and we discuss their health goals and different risk factors that they may have for surgery, and in general their health status. They may have different health problems that they have been dealing with, like high blood pressure, sleep apnea, diabetes, things that go along with obesity. And when we consider their health goals and their lifestyle goals, then we come up with the plan. Is it going to be bariatric surgery or weight loss surgery? Is it going to be medications for weight loss or other procedures that we do for weight loss, or just counseling, nutritional support, and group support and exercise? And we have those methods in our program as well. So yes, individual approach is always our strength.
And so is there anything that would preclude somebody from being a good candidate? I mean, you mentioned perhaps some pre-existing conditions, but what specifically might preclude somebody from this kind of surgery?
There are certain risk factors that patients have. For example, if someone had multiple abdominal surgeries, or they have a really bad heart, they're in advanced age, or they have other advanced stages of certain diseases, they may not be candidate for bariatric surgery. We take all those things into consideration. And of course, if patients are overweight, but they're not reaching certain criteria, then they may benefit better from other modes of or other methods of weight loss than surgery.
How do you prepare? How does a patient prepare for bariatric surgery?
This is a group effort. We have a team of professionals that work with each individual patient. They first come and see me for a consultation, and we have our nutritionist, our psychologist, and our nurse practitioner. Everyone works together to prepare someone for surgery. We first have to figure out whether or not they're a candidate, if they're meet the criteria, if their what is their baseline nutritional status. We do a whole bunch of preparation blood work. We check their digestive tract. We look at their we do an upper endoscopy, for example, to make sure that they don't have any signs of reflux, and we tailor the management of that patient to what we find in our pre-op evaluation. And then they proceed through a series of guided appointments and testing towards surgery and then beyond, because we have a whole program set up for patients after surgery.
And how long, before we get to the after surgery, how long is the procedure, let's say, day of?
So if someone comes to see me today, they can expect to have their surgery within 3 to 6 months after the first appointment. It is quite a commitment.
Mm-hmm.
It takes a lot of preparation, not only physically, but also mentally and emotionally. We work with our patients so that they're most prepared to be successful, because it is good for them and for us to be working together to sort of ensure their success in weight loss, emotionally, socially, and of course with their resolution of some of their health problems.
Right. It's not just about taking off the weight, which I think is perhaps what some people may think. if they haven't gone through it or known someone who has gone through it. How long is the actual surgery the day of? Is it a long procedure?
So these surgeries have evolved over time. So the way we used to do them, 20, 30 years ago is a little different. We do all of our operations minimally invasively, which means through very small incisions laparoscopically. The incisions are about the size of a grain of rice.
Wow.
Yes, we have small instruments, and our patients stay overnight in the hospital, but recover fairly quickly, and they can go home usually the day after their surgery. The operations range in time from an hour to 3 hours, depending on what operations we choose to do. But all of them are done laparoscopically, which is really nice for the recovery of our patients.
And what is recovery like? So you said they can go home the next day, but are they up and about the next day, moving around?
Absolutely. We
Oh, really?
want our patients to be active and walking. Of course, after having surgery,
Right.
people are a little wiped out. The general, because it's done under a general anesthetic, so people do feel tired. Of course, they have they have supports in terms of any pain medications they need or IV fluids after the surgery. But then immediately, even the night off, they start drinking water and other protein liquids so that we can get them ready to be independent at home and recovering. And people, for the most part, find that after that first week of kind of recovery after surgery, their energy levels actually increase, even though they're eating less and getting less calories. So it is really nice to see.
And what is there an average? Is there a number you can give people for like an average weight loss after surgery?
Certainly, there are benchmarks nationally, so our results are compared to national standards, and not only in terms of weight loss, how long that weight loss is staying off, but also in terms of the how our patients do after surgery. Do they have any complications or problems? And in our program, we actually have a lot of experience, first of all, but also very, very low numbers of any kind of adverse effects or complications. In terms of the numbers, if someone is, let's say, 100 pounds overweight, they can expect to lose anywhere between 60 to 70 to 80 pounds with bariatric surgery, depending on what procedures they choose.
So now the next biggest question people probably have is, how often do people able to keep the weight off? And does gender have anything to do with whether you're successful or more successful at doing that?
So that's a very interesting question. In terms of the gender, there are no gender differences as far as I understand. We do see a higher proportion of women that present with obesity and the complications of obesity, like diabetes, sleep apnea, high blood pressure, cholesterol, but certainly this is also prevalent in men. And we see both men and women to be very successful in terms of weight loss. I'm sorry, what was the...
I think you answered the question. So no real difference in gender as far as being able to keep the weight off. And so I think a lot of people also perhaps want to know, are there restrictions after the surgery? Dietary, lifestyle, exercise, anything like that?
So our patients usually are encouraged to increase their activity after surgery. Immediately after surgery, of course, we have a time of healing. People have incisions on their abdomen, so it takes some time before they can do really heavy exercise and lifting. We usually say don't lift anything heavy for about 4 weeks after the surgery, but usually after the surgery, even without the lifting, we encourage walking, increased activity. And people, when they see me 3 weeks after, I usually hear comments like, I do feel tired once in a while, but I just feel more spry.
Oh, that's a good word.
Yes. One of my patients just, I saw them just recently, and I said, I'm going to use this word because I really like it. And that really describes how our patients feel. They just feel more motivated to get out and do things and enjoy things that they perhaps couldn't enjoy before with their family, and activities outside or indoors. They're a little bit more free to do things, and of course, the first healing period is a little bit, I guess, less active, but after 3 to 4 weeks, people usually increase their exercise and activity levels. In terms of the diet restrictions, so patients feel satisfied and full with small amounts. So oftentimes our patients will come having a certain habit of eating large portions, certain types of foods that they are accustomed to. And those slowly start to change even before the surgery, because they go through such an extensive counseling and preoperative preparation process. They will change their eating habits a little bit, and right before surgery they have to be on a liquid protein diet, which in itself actually helps weight loss a little bit before the surgery. And then after the surgery for 3 weeks, they're on the liquid protein diet. They have to maintain a good water and protein intake. We say at least 60 grams of protein, at least 64 ounces of water, and we monitor that for them. And then afterwards, we encourage regular diet, increasing the protein. Certain types of foods may not agree with people. For example, if they were eating high sugar snacks or high sugar carbohydrate content foods, they may have certain effects and they may not tolerate them. They may not like them. Certain tastes may change. So
interesting.
That is one difference. There's one other important thing that I wanted to mention is that nutritional supplementation is very important with vitamins, and we monitor that for our patients in terms of their vitamin and micronutrient levels. We actually check that in their blood work frequently, routinely after the surgery, so that they don't become deficient.
That's a good point. Thank you for making that. I really want to ask you this question. Is bariatric surgery covered by insurance, and do people need a referral from a primary care physician in order to approach you guys?
So bariatric surgery and the whole program is covered by most insurances. There are certain criteria that insurances ask of us to adhere to. They don't just, if somebody's 20 pounds overweight, they're not going to cover bariatric surgery. Usually we say if somebody has a BMI of 35 with certain comorbidities or a BMI of 40, they are usually covered by insurance. And we have our staff and our office are very familiar with all the insurance companies here in New York, and they guide our patients and work with the insurance companies to get this covered. And in terms of the appointment, you can call 444-BARI, B-A-R-I, and make an appointment with myself or one of my colleagues.
Terrific. Thank you so much. That was a lot of information, but I think really important information for folks who may be on that journey. Dr. Kinga Powers, thank you so much for joining us. We have more coming for you after the break. When we come back, we're going to be talking about nutrition. Stay with us. Hello again and welcome back to Your Health Matters. We are now talking nutrition. Joining me is Allie Bailey, a registered dietitian from Stony Brook, Southampton Hospital. How are you today?
I'm really good, thank you.
Thank you for joining us. So nutrition is this really big word that I think people don't quite understand. Can you sort of explain, break it down a little bit? What does nutrition actually encompass for people?
Well, for me, I think what nutrition is about is just understanding the things that we should be doing lifestyle-wise, particularly what we eat, obviously, that will lead us into good health. Obviously, there are all sorts of foods and food choices out there, and what we're trying to do, the way we discuss nutrition with our different patients, is to individualize for different patients with different health needs and different disease states, what sort of things they might want to be really prioritizing, and really looking at the balance of whole foods that will basically give them, I think, the best health outlook they can have.
That's an important point that we want to reiterate, right? That nutrition for one is not nutrition for all, completely individualized, and what works for me may not work for you, may not work for the next person, right?
Yes, you're absolutely right. Particularly when we get, there's all different sorts of genetic differences. There's also differences in, people have certain health issues or even medications they're taking that will interfere with certain nutrients. So what we try and do is when we assess people, we look at sort of what we can do overall to give them health, but we might want to pay attention to specific nutrients. Our first objective is obviously to try and get people to include those nutrients in whole foods, because that's always by far the best way of doing it. The matrix of foods includes so many important things that I don't think even science understands yet that we should get. And then if we can't do that because of certain problems, to cover it in supplementation.
And so how did you get into this field to begin with?
I was always very interested in food. I was always just a real foodie. My first job was as a chef.
Oh, wow.
And I spent then several years in finance. And when I had my children, being pregnant just made me really think about, what am I eating? Why am I taking a supplement? What foods should I be eating to create another human being? And I think from there, I ended up applying for a master's degree, then a doctoral degree, and here we are. So I think it's this real interest in food and science and health.
You have an interesting background then, right? You come at it from a lot of different sides, which is probably gives you a great perspective. So here's a question that's really important. So, everyone's on social media. Maybe not everyone. Lots of people are on social media, and you're bombarded with images and impressions and suggestions about what is a healthy diet. And I think we should put that in air quotes, right? Healthy diet. So I'm guessing you're going to say you shouldn't be on a diet, you should just be eating healthy. But what does that mean, really, eating healthy?
Well, I think it's pretty simple in that you should eat a diet of whole foods. In general terms, you should you can eat a diet that's kind of mostly plant-based, but adding in some meat, fish, cheese, eggs. We love eggs, and include always, if you can, as many whole foods as you possibly can. So to the point where you're cooking with vegetables and meats and non-processed foods, that's as healthy as you can get, right? Now, of course, we are bombarded with processed foods. And I am a realist. I love a Snickers bar as much as the rest of us. And what I say is, these are treat foods, and you keep them to 10% or so of your diet, and you won't have so many problems. But if you can cook with whole foods, I think you will generally, from a nutritional point of view, remain quite healthy.
So I want to ask a question that's really pretty simple, but can you explain, maybe if people haven't really thought about it, what is a whole food? I mean, I think people know what processed food is, but what is a whole food? Just list a few.
That's a very interesting point, because people think of whole foods, I think, as being whole grains. And that's true. A whole food is a whole grain. To the extent that if you eat a whole grain rather than a grain that's had, if you think of a wheat grain, a processed one has had the husk and the seed removed. So what you're basically just getting is the carbohydrate or the glucose. That's a refined grain. But a whole grain with the husk has the fiber, it's got the oils in it, it's got the proteins, and it's got the micronutrients. Now, if you think about that, apply that, I think, to all foods. So what you want to do is eat, as much as you can, whole vegetables. So the vegetables that are full of fiber. And for me, I also think it's important to eat whole dairy, because I think also that with dairy, the fats contain a lot of fat-soluble nutrients. You should eat meat, everything whole, just food as it's basically grown or caught in the sea, or, from, that we raise, hopefully, in good circumstances in the case of meat. So we like things that are naturally raised as well. So for instance, if you're eating beef, if you can, because I know it's expensive, try and find grass-fed beef. So things that are organically raised in the way these animals are supposed to be fed.
I think for some people, it may come down to either just not knowing what to look for, but for lots of people, it may come down to finances. Eating healthy or healthier is unfortunately much more expensive than not eating healthy. Can you address that?
That is very, very true. Except, I think you can add a lot of fruits and vegetables, particularly vegetables, quite inexpensively to the diet.
Okay.
And I think the one thing, there is nothing more whole than an egg. Because if you think about it, an egg has everything that's required to make a chicken. So pretty much it's got everything you require. Even organic, pasture-raised, very good whole eggs are relatively inexpensive. So I often try and tell people, when you go to the farmer's market and you can get great organic produce, what's interesting is the pies and the cheeses, they are expensive, but look at the price of the fruits and vegetables. They are not that expensive. So try and add in things like that are not so expensive. And, you can eat 1 or 2 eggs a day, which is really a great way of adding full nutrients into your diet.
Good point. Thank you for that. So what is BMI, right? So when people are talking about healthy eating, we were just talking about weight loss. What is BMI? How concerned should people be with that when they're trying to maybe transition to a healthier style of eating?
Well, BMI, or body mass index, is basically a score we calculate by looking at your weight divided by your height in meters squared. And what it does is it gives us an indication of, relative to your height, what sort of weight you should be. So the general guidelines are that a healthy body mass index is between 18 and 25. Between 25 and 30, it's said that you are overweight, and over 30, you're getting into a level that's obesity. Now, as we mentioned before, everything's individualized. So for instance, a child growing very quickly below the age of 16 is likely to have a BMI somewhere in that very low range of 18. So with children, there's a different level. And that's very, very important to know, because obviously children and weight, we have to be very careful with that. On the other side, a very healthy man who does a lot of weight training, that builds a lot of muscle mass, which is very healthy for you to do, he will maybe have a BMI over 25. So we must always consider that the body mass index of, say, a well-muscled person is going to be higher, because muscle contains more water, and water is just heavier than fat.
Understood. Okay, good point. So since we're talking about body mass index, what's the best way to lose weight? Is it not nutrition-wise, but is it counting calories? Is it cutting your calories? Obviously, it's eating healthier foods, but what's the most healthy approach?
For me, I think, again, individualized, right? Because let's take a healthy person that doesn't have any other issues going on. Then the best way to lose weight is to eat 3 meals a day, to not snack, eat a good solid portion of protein with each meal. That will fill you up. Add to that a natural fat like olive oil that adds calories, and as many vegetables as you like. A mix of lovely vegetables, including starchy vegetables and non-vegetables. Add a fruit and a little grains also, you know, in just a little bit of carbohydrate as well. So that's the sort of balance that we now think of as what we call a low glycemic diet.
Mm-hmm.
Another great pattern of diet that's been shown to be very healthy in terms of for just a healthy lifestyle is a Mediterranean diet.
Oh.
Again, that brings a lovely mix of fish and eggs and all different proteins with lots of fruits and vegetables, olive oil, a bit of butter, natural foods, as I said, natural whole foods. 3 meals a day. And if you want, you can add in a little sweet treat every now and then, but trying to minimize sugar.
So is sugar in general bad for us?
In general, I think we should definitely put sugar on the just a treat food. No food is bad for you. I think you just have to look at the ability of your physicality in dealing with sugar. Mm-hmm. Some people have the ability to eat lots and lots and lots of sugar. It never affects their blood sugar, their liver, fantastic. For those people, I'm very happy for you. But I think for most of us, we have to be a bit wary of sugar. Sugar is partly glucose, which generally speaking is a relatively, easy food to process, and partly fructose. Fructose is processed in the liver, and for a lot of people, too much fructose can lead to liver damage, which leads on to problems with your blood sugar, which can lead to ill health. So I'm sorry for a long answer to that.
That's a good explanation.
But I think that the understanding is for most people, as long as you don't have sugar at every meal, that you pay attention to if you do buy packaged foods, things like tomato sauce, which you can buy amazing packaged tomato sauce that I would consider as being whole food, because I'm seeing tomatoes, olive oil, garlic, maybe some spices and some onions and some basil. Now,
but potentially high sugar.
But potentially what you want to watch out for, they've not added a lot of sugar. So I think you have to just be a little bit wary of, reading food labels so that you can avoid sugar in foods that you don't think there's sugar in to begin with.
Right. Really great point. Thank you so much.
And then it leaves you a little bit of time to have a little treat with sugar that you can control.
Right. Allie Bailey, thank you so much. I love when you said you're a realist, because I think that's really what people need to hear, right? Figure it out, but, focus and pay attention. That's all the time we have for Your Health Matters. Thank you so much for joining us. We'll see you next time.
Funding for Your Health Matters is provided by Stony Brook Southampton Hospital. As part of the Stony Brook Medicine Healthcare System, Stony Brook Southampton Hospital is committed to providing world-class academic-based medical care to our entire East End community.